Hi, I'm Skylar Wade, and today I will be discussing the urinary system, specifically the bladder. What does the urinary system even consist of? Well, the urinary system includes the kidneys, ureters, bladder, and urethra. Each of these plays an important role in helping your system to filter your blood, remove waste, and remove excess water. Anatomical location. The urinary bladder is a muscular sac in the pelvis just above and behind the pubic bone. It is posterior to the pubic symphysis and below the parietal peritoneum. Posteriorly, the anterior wall of the vagina sits behind the bladder in females, and in males, the rectum is located posterior to the bladder. Inferiorly, the muscles of the pelvic diaphragm support the bladder. The bladder is located in the lesser pelvis when empty and extends into the abdominal cavity when it's full. What is homeostasis? Homeostasis is any self-regulating process by which an organism tends to maintain stability while adjusting to conditions that are best for its survival. Homeostasis. As we previously went over, the urinary system consists of the kidneys, ureters, urinary bladder, and urethra. The kidneys filter the blood to remove waste and produce urine. The ureters, bladders, and urethra together form the urinary tract. The urinary tract acts as a plumbing system to drain urine from the kidneys, store it, and then release it during urination. The bladder plays a major role in filtering out excess fluid and other substances from the bloodstream and secrete waste. Along with this, the urinary system also maintains the homeostasis of water, ions, pH, blood pressure, calcium, and red blood cells. Homeostasis. pH. The kidneys maintain normal acid-base balance through the reabsorption of sodium and the tubular secretion of hydrogen and ammonium ions. Urine becomes increasingly acidic as the amount of sodium and excess acid retained by the body increases. Water. The amount of water in the urine is controlled by the kidneys, which helps to maintain water balance. The urine is taken from the kidneys to the bladder by the ureters. The bladder stores the urine until it is ready to expel it from the body. Ions. Hydrogen ions are produced as a natural byproduct of the metabolism of dietary proteins that have accumulated in the blood over time. The kidneys secrete excess hydrogen ions into urine for elimination from the body. Calcium. As we all know, almost all of your body's calcium is stored in your bones. However, a small amount circulates in the blood, and the remainder is filtered by the kidneys and passed into your urine. Red blood cells. In addition to maintaining fluid homeostasis in the body, the urinary system controls red blood cell production by secreting the hormone erythropoietin. Blood pressure. The urinary system also plays a role in maintaining normal blood pressure by secreting the enzyme renin. Predictions. The urinary system maintains blood homeostasis by filtering out excess fluid and other substances from the bloodstream and excreting waste. So imagine if the bladder was not able to do so, what would occur? Well, many things can occur and some can be fatal. For instance, urinary retention. Urinary retention is a condition in which you cannot empty all of the urine from your bladder. It can be classified as acute or chronic. During acute, you may feel like you need to urinate badly, but nothing comes out when you try to urinate. You can feel extreme pain or discomfort in the lower abdomen if you're not able to urinate for a long time. This is because your bladder continues to expand and put pressure on the surrounding nerves and tissues. Chronic urinary retention happens when you can urinate, but all of the urine does not drain from your bladder. Over time, urine left over in the bladder may build up and expose you to toxins that your body would naturally typically release. Predictions continued. Along with retention, it can also cause hypervolemia, which is known as fluid overload. This is a medical condition where there is too much fluid in the blood. The opposite condition for this would be called hypovolemia, which is too little fluid volume in the blood. Hypovolemia is due to an excess of total body sodium in water, which leads to the expansion of the ECF compartment. Hypovolemia refers to a state of low extracellular fluid volume, generally secondary to combined sodium and water loss. All living cells must maintain an adequate fluid balance to preserve homeostasis. Cells and tissues. Cells. The microscopic structure of the urinary bladder wall is organized into the following layers from inside out. Lining epithelium. The urinary bladder lining is a specialized stratified epithelium called the urothelium. Lamina propria. This is the suburothelium layer separating the urothelium and underlining muscularis propria. Muscularis propria. This is also known as the detrusor muscle. It consists of 3 layers: inner longitudinal, middle circular, and outer longitudinal. Serosa. This is the thin connective tissue layer that covers the bladder dome and is continuous with the peritoneal layer of the abdominal wall. It also contains blood vessels of various sizes. Adventitia. This loose connective tissue layer serves as the bladder's outer layer in areas of the bladder where there is no serosa. Cells and tissues. We're going to be going into the 4 layers that make up the bladder. From the inside out, the epithelium is the first layer on the inside of the bladder. It acts as a lining for the bladder. The lamina propria is the next layer. It consists of connective tissue, muscle, and blood vessels. Wrapped around the lamina propria is the layer called the muscularis propria or detrusor muscle. According to Johns Hopkins Pathology, this layer consists of thick, smooth muscle bundles. The final outer layer is the perivesical soft tissue, which is made up of fat, fibrous tissue, and blood vessels. Anatomical description. Anatomically, the bladder is contiguous with the ureters above and the urethra below. It is divided into 4 anatomical parts: the apex or dome, body, fundus, and the neck. The apex is the anterior superior part of the bladder that points towards the abdominal wall. The fundus or base is the posterior inferior part of the bladder. The body is the large area situated between the apex and the fundus. The neck of the bladder is the constricted part of the bladder that leads to the urethra. Relationships. Digestive system. As we've been over, the urinary system works as a filter by removing toxins and waste from your body. It does this by using a series of tubes and ducts to pass this waste. These tubes are connected to the blood vessels and digestive system. The urinary system helps the rest of your body work properly. Many things can occur in the bladder that can affect the digestive system. An example can be a urinary tract infection. UTIs typically cause bladder-specific symptoms. However, the bacteria causing the infection can also infect your abdomen, specifically your lower abdomen. You may experience a lot of pressure and pain and bloating. Functions. The urinary bladder is a storage reservoir for urine. Urine is a liquid-containing waste product given off by the body and extracted from the bloodstream by the kidneys. The major contractile muscle of the bladder is the detrusor. Urination involves either sustained contractions or short intermittent contractions of the detrusor, along with the contraction of the muscle in the urethra, which is a duct from the urinary bladder that conducts urine from the body. Disease. Interstitial cystitis. What is it? Interstitial cystitis is an inflamed or irritated bladder wall. This over time will cause stiffening of the bladder wall, which will allow your bladder to hold less urine. The bladder will not be able to hold as much urine as it did in the past, and it is a chronic disorder. Interstitial cystitis may also be known as painful bladder syndrome and frequent urgency dysuria syndrome. Disease continued. Interstitial cystitis. How is it treated? Researchers have not found one treatment for interstitial cystitis that works for everyone. Doctors aim current treatments as relieving symptoms in each person on an individual basis. A healthcare professional will work with you to find a treatment that meets your needs. A plan may include lifestyle changes, bladder training, physical therapy, medications, and bladder procedures such as colonoscopy with hydrodistension. This is a procedure that fills up your bladder with water. It is used to help you find out what may be causing your bladder pain. You may have to try several different treatments before you find the one that works for you.